Mr. President, I rise this evening to help deliver a message from American families to my colleagues on the other side of the aisle. The American people have sent a clear message to Washington. The message is that they do not want us to go forward with this partisan and mean health care repeal bill. But incredibly, we are today about to embark on a vote to do the exact opposite. What's happening in Washington this week is that we are completely ignoring the message that Wisconsinites and that hardworking American families across this country have sent for us to hear. Haven't you been listening? To my colleagues on the other side of the aisle, have you been listening to the calls pouring in from families in your states? Have you been listening to the voices of parents and their children, of the school teachers and doctors, and of the working people who are daily struggling to get ahead? These messages have been sent to Washington. They've been sent loudly and for many, many months. In fact, for too many months for you to possibly not have heard them. The American people don't want to pay more for less care. They don't want the age tax or the higher premiums that this plan is offering. People with pre-existing conditions don't want to be thrown into a high-risk pool or priced out of the coverage that they have today. They don't want bare-bones insurance that doesn't cover the essential services and life-saving care that they may need. They don't want their loved ones who depend on Medicaid for nursing home care, or their disabled children who rely on Medicaid funding at school, to have their care put at risk through caps and through cuts. The American people don't want a plan that will make things worse. It's hard for me to believe that Washington hasn't heard this message, because I've been listening, Mr. President. I've been listening to people like Jean. Jean is from Baraboo, Wisconsin, and she told me that she's scared because her Crohn's disease would cost her a fortune if her pre-existing condition were not covered. She told me that she needs the health care she has today because, quote, my husband ruptured a disc in his back that prevented him from getting a job that promised us coverage. So now he works multiple jobs, end quote. And I've been listening to Mary from Kenosha, Wisconsin. I met with Mary recently, and she told me about her son, Kyle. Kyle, at a young age, was diagnosed on the autism spectrum and was never expected to learn to even speak. When Kyle was 7, medical professionals spoke with Mary and said that Kyle might have to be removed from his home and left to be cared for in an institution. But Mary had hope. And thanks to Medicaid, Kyle was able to receive some very specialized medical therapy for his autism, and he was able to remain at home. He was able to receive an education. He was able to get his driver's license, and now Kyle is attending college. Well, Mary is terrified, nonetheless, that this bill's drastic cuts to Medicaid would rob Kyle of the care he needs to achieve the independence that he has worked so hard for his entire life. And Mary told me about her concern for so many other families with similar situations. I've been listening to Greg. Greg is from Stoddard, Wisconsin. He has no idea how he and other older Wisconsinites will be able to afford higher costs for health care. And for Greg's sons, who both have diabetes. They are already struggling with skyrocketing insulin prices. I've been listening to the Schomburg family in Seymour, Wisconsin. Their daughter, Zoe, was born with a congenital heart defect. She had to have open heart surgery at 5 days of age. Now, Zoe is guaranteed coverage without being denied or charged more. But Zoe's parents are scared that this repeal plan will make things worse. When Zoe's mom, Chelsea Schomburg, was told about how this plan would weaken the guaranteed protections and care that people have today, she said in her letter to me, it's like they're taking the American dream from her. Kids in Wisconsin with pre-existing conditions. These children are counting on you to protect that right. Now, this isn't right, this isn't fair, and it's not who we are. Mr. President, if my colleagues who have been drafting this plan behind closed doors have not been listening to the messages of fear and anxiety from the American people, maybe they will listen to why this proposal is very personal to me. When I was 9 years old, I got sick. I got really sick. I was in the hospital for 3 months, and following my getting out of the hospital, I required significant follow-up care for nearly a year before I regained my full strength and fully recovered. But when it came to health insurance, it was like I had a scarlet letter. My grandparents who raised me couldn't find a policy that would cover me, not from any insurer and not at any price. They had to pay for my care out of pocket. And I can tell you they made some major sacrifices to do so. All because I was a child who had been branded with those terrifying words, pre-existing condition. So, what are we doing here, Mr. President? It is time to stop the partisan nonsense. The people of Wisconsin did not send me to Washington to take away people's health care. They sent me to fight for people like Zoe and Kyle and Jean. What I hear from people in Wisconsin is that they want us working together to protect the care people have and to make it more affordable. We should be working together to lower costs, like skyrocketing prescription drug prices. We should be working together to strengthen the insurance market and give people more options. But we should not be working on partisan repeal legislation that will make things worse, that will leave millions uninsured, that will make health care more expensive, and that will price families out of the care that they have today. It's time we listen to the messages that are being sent to Washington. It's time that we work together across the partisan aisle to do our jobs, the jobs that the American people sent us here to do on their behalf. I hope that the congressional majority will join me and my colleagues to work together to strengthen health care and to move our country forward. I thank the body, and Mr. President, I yield.